So, good day. This report is about bone pinning or intramedullary pin fixation. So, surgeons are yours truly, Tricia Joy Marzo, Leca Sopravilla, and Gladys Carcayaso. So, what is intramedullary pin fixation? This is used to stabilize tibial diaphyseal fractures, providing excellent resistance to bending but no resistance to rotational forces. So, hindi siya mag-bend but pwede pa rin mag-rotate yung bone. For the indications, it is also used for the fixation of bone fractures, syempre, bone reconstruction, and as guide pins for insertion of other implants. For the anatomy, the humerus of the dog is the bone or bone of the arm, or also called the brachium. So it is divided into a shaft and two extremities. So we have the neck, the head, the body, and the condyle. Next, bone is the femur of the dog, or also called os femoris, which is the heaviest bone on the skeleton. The right and left of femurs lies in the parallel sagittal planes when the animal is standing. So in this picture, we have the left femur with the patella, cranial aspect, and beside this picture is we have the craniocaudal radiograph of a left femur. For the operative technique, so in intramedullary pin fixation, we have two technique or two options. We have two options. We have the normal grade and the retrograde fashion. In normal grade fashion, placing a pin using normal grade, start the pin at the appropriate location at one end of the long bone and drag it down to the medullary canal to the fracture, reduce the fracture, and continue to drive the pin until it sits in metaphyseal bone. So, dito sa normal grade is mag-i-start tayo, mag-drill tayo muna ng hole from the proximal part ng bone. Tapos, doon i-insert yung pin. Not unlike in retrograde naman, in inserting a pin in the retrograde fashion, first expose the fracture and insert the pin into the medullary canal of the appropriate bone segment. So, dito, di ba, sa may normal grade is mauna tayong mag-insert ng pin sa may taas or sa proximal part ng bone. But in here, mag-i-start tayong mag-insert ng pin sa may fracture mismo. Sa may retrograde. In this activity, we made use of normal grade fashion. And in intramedullary pin fixation, we may also use circlage wire. Use a wire passer to place the wire around the bone without excessively reflecting soft tissue. Do not entrap tissue between the wire and periosteum and prevent slippage of loosening of the wire. Place the wires perpendicular to the bone surface. So, diba, kapag gumamit tayo ng circlage wire is meron yung end niya, which is may cause friction sa may muscles, soft tissues, and that dapat iwasan natin yung ganon. The end of the wire should not irritate the muscles or the soft tissues. So, in application of circlage wire, we have the loop circlage and the twist. Kapag loop circlage, first we have to create a loop muna, and then we encircle the circlage wire into the bone, and then the end of the circlage wire should be um inserted at the loop, and then we will tighten it up by creating a by bending the end of the loop at the loop itself. And then by using a twist naman, parang we will encircle the circlage wire na agad, tapos iti-twist lang natin, and then after twisting, cut the excess. We have to cut the excess wire and then create an alternate bend to prevent yun nga, irritation in the soft tissues. So for the proper placement of circlage wire, it should be placed at least 5 millimeter from fracture ends and is spaced 1/2 to 1 times of the diameter of the bone. So these are some of our pictures in doing this activity. So actually parang nahirapan kami. At first nahirapan kami sa procedure na to because kasi yung bone na ginamit namin is too small, and mahirap maglagay ng circlage wire, and ano pala, obvious naman hindi ito live animal, and yung ginamit kasi namin na bone is bone ng canine, which is namatay na a year ago, and then which is yung sa may canals niya is masyado nang malawak to the point na kapag na-insert na namin yung pin is that parang hindi siya sapat to hold the bone. Kaya kasi nga masyadong makapal yung sa may canals niya. And then in this picture, this first two picture, we can see the procedure of drilling the proximal part of the bone. And then after drilling, sinusukat na namin yung pin na ilalagay sa bone, and then after masukat, nilagay na namin. And then after inserting is that we have to cut the edge of the pin, and then after that, we place a circlage wire using the twist technique. So mas mahirap pala yung loop kasi mahirap siyang i-tighten. Just not unlike dito sa twisting. Kailangan mo talaga. Twist mo na siya. And then here we are doing our tasks. And then hindi kasi sapat yung circlage wire and the pin itself. That's why we also make use of the plate, and then tinake na rin namin yung bone. And this is the final product. This one. So dito, we can see at the middle na merong isang bone na wala siyang plate. It's because na-secure na kasi siya ng no cartilage wire, and yun, cartilage, na-secure na siya, kaya hindi namin ginamitan ng plate. And for post-operative care in live patients, kailangan natin ng provide ng analgesics, of course, because this procedure is very painful post-operatively, and radiograph. We need to repeat the radiograph every 6 to 8 weeks to para makita natin if there's an improvement or nagkakaroon ng calcification doon sa bone na surgery. And also, we have to restrict movements, of course, movements, activities ng patient. Considering na yung patient natin is mostly in veterinary medicine are canine. Most of them are very active, and we have to restrict their movements, and parang mas advisable na naka-cage lang sila, and minimal lang yung galaw nila. And physical rehabilitation to help them heal and be back to their normal life. Complications, we have delayed union, matagal. Non-union, hindi siya nag-ossify, nag-ossify yung bone. And osteomyelitis, or merong inflammation or swelling sa may bone. And malunion, which is nag-ossify nga sila, pero hindi naman tama yung yung placement nila, and of course infection of the surgical site. So this procedure pala is at first sa group namin is very stressing kasi nahihirapan kami, pero nung tumagal na is nag-enjoy kami. We enjoyed the drilling. And that's it. Thank you.